How's it going, everybody? Welcome to another episode by yours truly. In this episode, we're going to be talking about some medicines that have some crazy side effects. Not necessarily crazy, but not necessarily the kind of side effects that you would expect drugs to have, especially being the fact that doctors, which we all just love to go to and know and trust, right? No, wrong. The correct way to look at them is to look at them as if they're going to kill you. Because think about what they tell you to do. They tell you to take this drug, take that drug. Let's say if you have let's say you have restless leg syndrome, right? So here, I'm actually, you know what? Let's just start this list because I'm sure some of you probably might have had these problems. People that do go to doctors, because me myself, I don't really go to doctors and stuff. I don't really see the point of it. I feel like if I'm gonna get unhealthy or something like that, then it's just meant to be. I'm one of those people that's like, God will help me, and I'm not really too concerned about the consequences or the repercussions of that. But I don't hardly ever get sick though. I can honestly say that if I ever get sick, it's usually like a cold or like sinuses. That's the biggest one. Sinuses and colds. That's all I ever get. And the colds themselves, they only last, I don't know, maybe 2 or 3 days at the most. I'm sure most people like that as well, but I don't know. I don't hardly ever get sick. If it is something serious, then I might get it for like a day or two. But I'm healed within, or I feel better within 2 or 3 days. I feel a lot better. So, anyways, let's jump right on into this list. First in the list, we have Mirapex. Mirapex, whatever, however you want to pronounce that. So, this is for restless leg syndrome, right? Okay, so the side effects include hallucinations. It says hallucinations may occur. Why does it cause hallucinations? Like, what chemical is being put inside of this drug to make you hallucinate, right? So, increased gambling, sexual appetite, and other overpowering urges. Like, what other overpowering urges is this going to make me feel like? Why is it going to make me feel like that? And another thing is like, why is it going to make me want to gamble more? Like, I'm going to take this drug and say, ooh, man, you know what? I want to go gambling today. That's what I want to do. That I'm going to go gambling every time I take this pill because that's what I do. All right, so moving right along here. Next one is Abilify. I've actually heard of this one before for bipolar disorder and schizophrenia. Which, if you think about this, right, I'm sure a lot of you've heard this before, but all doctors say that everybody has some form of bipolar and they want you to take this medicine or that medicine. Okay, true story here, right? So I used to have like these kind of like seizure type things, but they wasn't really seizures. I don't really know what they were, but I kept going to the hospital for it because I didn't understand what was going on with my body, and it wasn't that I wanted like some kind of medicine or nothing because I don't. I hardly barely take Tylenol and stuff. So, anyways, long story short, they wanted me. The first thing they kept asking me was first if I was on drugs. Never really been on drugs in my life. I smoked a little bit of weed here and there, but I think everybody does that. If you don't, you're lying. Whatever. So, so I went and they told me that it was my bipolar, my mental disabilities that caused me to have these seizures, and I was causing them on myself. And I don't know. They were like, "Oh, you're stressed out," or uh, "You have too much on your mind." Anyways, so yeah, but they kept trying to get me to take stuff like Abilify. So, anyways, let's read the side effects of this drug, right? So the side effects of this drug is coma or death and trouble swallowing. So you want me to take something that's going to either put me into a coma or make me die, right? So you would so you're telling me if I read the side effects correctly, so you're telling me that if if I take this Abilify that you're telling me to take, which they were telling me that's one of the drugs they were telling me to take. So you're telling me you'd rather me go into a coma or die, or least likely, or the least troubling is trouble swallowing. So basically, let's just say I had trouble swallowing for after taking this pill, right? So I take this pill and I have trouble swallowing, and don't you think that somewhere along the lines that would cause me to have more uh, ups and downs because of the the stress of not being able to freaking swallow? It's like I can't even drink my food. My wow, drink my food. Did you catch that? I caught that. That is terrible. So, anyways, so you're telling me that you would rather me not even be able to drink water or drink soda or drink anything or eat anything, but so basically I would die from not being able to have, from having trouble swallowing because I wouldn't be able to eat properly. So basically, this drug's gonna freaking kill you. But you'd rather me die and be going to a coma than just have a little bit of, emotional trouble like every normal human being has in this world. Anyways, so the next one we have is Flomax. It decreases symptoms from having an enlarged prostate, mainly frequent urination. Okay, so with Flomax, like it says, it stops you from peeing so much, right? Okay. That's just more of like a nuisance thing. You shouldn't be going to a hospital for that. I mean, unless it's getting to the point where it's like you're peeing on yourself constantly. Like I can understand that. Okay, so the side effects of this drug is runny nose, which that's okay, that's fine. Dizziness, which is getting a little worrisome here, and decrease in semen. What? Why? Anyways, so the next one we have is weight loss aid. It's Allah, Ali, Alibaba. I don't know. ALLI. So ally. Okay, so this is your ally, right? Let's just say that's what it says. For now, we're sticking with Allah. Or, excuse me, ally. These changes may include gas with oily discharge. You're gonna have gas with oily discharge, okay? An increased number of bowel movements, an increased number of bowel movements, an urgent need to have them, and an inability to control them. So you're telling me that I want to lose weight, so I go to a doctor and I say, "Hey, I want to lose weight." And you're like, "Oh, okay, here, take this. This is your ally. Okay, take it whenever 3 times a day or once a day. Let's say it's a once a day pill." So that means in order for me to lose weight, I'm gonna have to crap myself quite a few times from what these side effects are telling me. So you're telling me that you want me to have these side effects and poop on myself so that I can lose weight. So basically, kind of, you want me to humiliate myself because I'm fat. Basically, is what you're saying. But these are the doctors that you know and love and trust, right? Okay, so moving right along here. Okay, so the next one on the list is called Advair for asthma, right? Okay, so I used to have asthma myself, and I used to take inhalers. And before I actually get into this one, I remember whenever I was a kid, I think maybe I was like, I don't know, maybe like 6 or 7, something, somewhere around there. I'm not too sure. I'm 29 now, so I can't really recall that far back. But I do remember that I took this inhaler, and I think it was albuterol, something like that. And when I took it, it wasn't even like maybe 5 minutes later, and my throat started closing up, and I wasn't able to breathe. So my mom, thankfully, thank God for this, my mom was able to sense that I couldn't breathe because I couldn't make no sound. I mean, I can't go, I couldn't even make that sound. My throat was closed off. So all I remember after that is like on our drive to the hospital or to the emergency room, which was again, thankfully, only like 2 or 3 minutes away from our house, from where we lived in Greenville. And I remember passing out. That's the last thing I remember. I don't even remember what else happened after that. So let's get back to this. So this one is this one says asthma related death. So basically, I don't know if you've ever noticed, but if you ever look up any kind of asthma like inhaler or anything that helps you breathe, like you flip the little freaking thing over and then you suck it up in there, you're killing yourself. Because if you look at if you ever notice, all the side effects say that it could cause asthma related problems. It's like, why is it going to cause me more problems to take something that my doctor prescribed to me, when my doctor is supposed to know me more than just about anybody else? That's what their job is for, right? I mean, am I wrong here? I just don't understand the concept behind going to a doctor and the doctor's like, "Here, take this, so it can freaking kill you." Oh, it's gonna help you though. It's gonna help you. All right, so not last but not least, definitely not least. Okay, so we have Accutane for acne, right? It's Accutane for acne. Okay, so here are the side effects of this drug. You have depressed mood, trouble concentrating, sleep problems, crying spells, aggression or agitation, changes in behavior, hallucinations, thoughts of suicide or hurting yourself, sudden numbness or weakness, especially on one side of the body. So basically, you're gonna have a freaking stroke trying to get rid of your acne. Okay. Okay. So blurred vision, sudden and severe headache or pain behind your eyes, sometimes with vomiting, hearing problems, hearing loss or ringing in your ears, seizures, severe pain in your upper stomach spreading to your back, nausea and vomiting, fast heart rate, loss of appetite, dark urine, clay colored stools, jaundice, which is yellowing of your eyes, and your skin, excuse me, severe diarrhea, rectal bleeding, black, bloody, or tarry stools, fever, chills, body aches, flu symptoms, purple spots under your skin, easy bruising or bleeding, or joint stiffness, bone pain, or fracture. But hey, at least you don't have pimples, right? That's quite intense. All those different side effects of that drug. But you have seizures because you want to get rid of your acne. I would suggest you don't take Accutane. I'm sure it's probably an old drug by now. Hopefully it is. Hopefully nobody takes this crap anymore. You just go get some, what's that stuff called? I don't know. I don't even remember what the name of the stuff is. You go get that cream, you rub it on your face, and then you wash it off. You know, tell you what I used whenever I was a kid. Whenever I was a kid, I would use hydrogen peroxide. It's like a cream, and you rub it on your face, and it just like clears it up within like a few days. It's really good. And I don't know the side effects of it, but I mean it's just a cream, so hopefully it's not that bad. Unless you're like allergic to peroxide, but why would you be allergic to peroxide? So anyways, hope you guys enjoyed this video. If you did, please leave a like, comment, and subscribe. I also have another channel. It's a gaming channel. It's called Nethrozic Gaming. I do daily videos on there. Recently, I've been doing the 7 Days to Die series. That's modded with Valmod. If you don't know what it is, you should go check it out. I'll leave a link in the description. As always, I hope you guys have a great day, and I'll see you next time.